ensure that people have access to their medicines. Wherever we have challenges in terms of movement, lockdowns have been extended. Even now, we had the news on that, and there's curfew that is already in place, and it will be extended for another 21 days. So the most critical thing is to ensure that our patients will continue having access to care products that they need, that's their medicines, and even in terms of professional guidance and counseling that they need will not be affected at this point. So the focus of the day will be on managing high blood pressure during COVID-19. We'll look at the scope of what hypertension covers, the management protocols that have been in place, and the current fears that we're having with the current situation on COVID-19. Because according to evidence, there has been evidence that there's an increased risk of these patients with high blood pressure developing severe complications. So how do we cope with such kind of a situation? Because we don't want them to get infected with coronavirus disease. Then at the same time, they have to continue managing their blood sugar levels. So that would be the scope. Then after that, we'll have the session where Tony Wood will be sharing some of the insights that he has for us in terms of what they're doing. So before I move into the introduction part, I'll give Tony Wood a moment just to introduce himself. Then we get started.
Okay, thanks, Dr. Odiamba. My name's Tony Woods. I'm the managing director for MyDawa, and I'll kind of go through what MyDawa is and what we do a little later on. So I won't take up too much time. Just say it's a pleasure to be here. We're very happy to be part of the webinar this evening. Thank you very much.
Thank you so much, Tony. So as we get started, I'm Odiamba David. I'm part of the Reculture team. So in terms of what we cover when we're talking about hypertension, this sustained increase in blood pressure, the normal blood pressure levels are normally required to be around 120 to 120/80. That is, systolic blood pressure is the pressure that your body records when blood is being pumped from your heart. Because from the common understanding, I believe the people who are attending this session has a basic idea of what biology of the human body in terms of the blood flow. So when your heart pumps blood into your body system, supply oxygen, nutrition, and every other thing that moves around your body, we have a pressure that is required that is enabling you to transfer those nutrients according to the required standards. And at the same time, that pressure should not be going to disrupt your organ function. Because as we mentioned here, when the pressure is higher, that's why the people have hypertension. You have an increased risk of having stroke, you have an increased risk of kidney failure, and you have an increased risk of heart failure. Your heart might not be able to pump enough. And that is something that we're going to look at as when we're looking at the regulation of blood pressure levels. So the chart that we have on the screen, if you can see my screen, we have the normal blood pressure levels, that is 90 to 119 in the systolic. Diastolic is when blood is coming back to your heart between 60 to 79. That's why we normally have the standard of 120/80 millimeters of mercury. Then pre-hypertension, you have a risk, but you're not hypertensive. We look at it from 120 to 139. In diastolic, that's 80 to 89. So that is 140/90. Beyond that, you are considered to be hypertensive. So these values are very critical. For example, if someone has a risk of developing high blood pressure, then it's recommended that they continue having their tests, doing tests to check their blood pressure level. They're normally regular checkups. When you visit a health facility, you can't get your blood pressure checked. However, at this point in time, we are not encouraging you to visit a health facility just for a normal checkup, because you might be exposing yourself, and we want to try as much as possible to prevent the risk of infection. So on the next slide, we have the different causes of hypertension. So there are two forms of hypertension normally. The first one would be the secondary hypertension. There is an underlying disease condition. You are sick, you're suffering from one of the diseases that I've listed here, probably renal artery constriction, coarctation of the aorta, pheochromocytoma, Cushing's disease, and all these. So these are conditions, for example, in renal, you have a kidney problem. With kidney problems, your body cannot get rid of waste in your body and even the extra fluids. So if you can't get rid of fluids, the fluids are accumulating. It's like when you have a water supply system, when there's so much water in the system, then you might not be able to pump it enough. So that is going to affect you. So you have to get rid of some of it. The aorta is the blood supplying organ that we have, the vessel that we have in our body. So when the aorta can't supply enough of it, or it might have some blockages, then that's going to affect your normal level. So in terms of secondary, it's coming as a result of another disease state. Then we talk about primary hypertension is a high blood pressure that is beyond our control. We don't know what could be a contributing factor to it, but we understand that your blood pressure levels are beyond the recommended that we mentioned earlier, 120/80. So the factors that can increase an individual's risk of developing hypertension, there is heredity. Probably you're coming from a family where majority of your family members have an increased risk of or have suffered hypertension, high blood pressure, or a relative of yours who is a close relative, let's say your first level relative, a brother, a mother, a father, then you have a risk of developing high blood pressure. In stressful circumstances, this is something that we normally know, the flight or fright response. So the fight or flight response occurs when your body now is producing a number of chemicals, especially noradrenaline and adrenaline, to enable your response to a stressful situation. That increases the rate at which your heart is pumping blood. And when a pump is pumping at a faster point, then it means even the flow of the fluid that's moving the system increases. So that is what covers the psychological stress as a contributing factor to hypertension. Sustained stress can cause prolonged hypertension. Then you have dietary factors, increased salt intake, reduced potassium and calcium intake. So when the amount of salt that you put in your food, the amount of salt that you consume will also influence whether you're developing high blood pressure or you're not developing it. Another risk factor, we have obesity, increased weight, that is overweight, smoking, and lack of physical activity. So once we understand that these are the contributing factors, some of them we have control over, like the psychological stresses that might come around, the dietary factors, weight management, smoking, and lack of physical activity. Those ones we can't have control over. We can find ways of coping with that and acting accordingly. However, for the genetic factor, we might not be able to influence it. And at the end of the day, we have to find a way to manage our blood pressure levels based on the circumstances under which we're operating. So this is the chart that I mentioned that we'll be discussing in terms of the regulation of blood pressure. So we have different control centers of how our blood pressure levels are regulated. One, when we start from the brain level, you have a coordinated system. Every signal, every activity that happens in your body is controlled from the brain. So in the CNS, that is the brain center, we look at sympathetic nerves that are producing a number of chemicals, and these will influence whether your heart rate is increasing or decreasing. When you are scared, it's processed in your brain, and that processing of that signal will enable you to respond to that stimulus in a particular way. So if it's scared, increased production of adrenaline, your heart is pumping enough blood to enable you get the sufficient energy to run away from the stressful circumstance, the stressful situation that you are in. At the heart level, your heart can pump either fast or low. And that gives us another point where if the heart is pumping fast enough, you might have a higher blood pressure depending on the circumstance that you're dealing with. Then the amount of fluid in your body. The volume is normally controlled by the kidneys, and that's why the kidney is an essential organ. So that is where we have waste being eliminated from your body. We have excess fluid that are being eliminated from your body. And there are very critical chemicals that are released from the kidney, that is renin, that will influence how you're responding. And that is what's going to cause the critical concerns that we're having at this point when we have coronavirus. And then it has binding is to a particular end receptor, the SCE2 receptor, that has a higher risk of that is correlated to hypertension management, because we have drugs that are acting on the particular receptor as well. Then in the blood vessels, we have arteries, veins, the venules, arterioles, and the capillaries. So in this kind of a situation, when the piping is narrower, constricted, then it will increase resistance. When the resistance is high, that is going to affect the pressure of your blood. So water flowing through pipes, with a smaller pipe, the pressure will be higher. With a larger pipe, the pressure gets lower. So those are the key critical control points that we need to look at when we're even looking at how we are going to manage hypertension. So those, mark that in mind. So in terms of management, how do we go about it? We know the risk factors. So the main goal of managing hypertension is to ensure we achieve the desired blood pressure levels, not sugar, blood pressure levels, and the BP range should be 120/80 millimeters of mercury or below that level. So in your lifestyle modification plan, You need to have an active lifestyle, because we realized sedentary lifestyle, lack of movement or physical activity, increases your risk of developing hypertension. So you need to do physical exercises, walk from your house to your workplace if it's closer to where you are. And those are some of the things that you can look at as well. The reduced alcohol and tobacco smoking. Reduce the alcohol intake. We recommend that for men, you can take up to 30 milliliters of alcohol in a day. For women, take 15, and people of lower weight can also take lower levels. Then there is the dietary modification. The kind of food that you take will influence whether you have a risk of developing hypertension or not. And that starts with high fat foods, high sugar foods, and all that. They increase the deposition of fats in your body, saturated cholesterols, and that will increase your risk of developing hypertension as well. So you have to reduce that. In salt intake, you should take up to 6 milligrams per day of salt. That is the sodium chloride, the normal salt that we use, put in our food. So you have to regulate that as well. Then you can increase your potassium intake level. Potassium, you can obtain it from bananas, which is very critical. You can buy fruits and take that. Then another thing that you can work on is increasing your calcium intake. That is from green leafy vegetables, from milk. You can increase calcium, which helps you lower your blood sugar to a small extent. That is on the dietary. Then other than the lifestyle modifications, we have use of medicines, which is critical. But when it gets to medicines, there's need for a professional who will be giving the guidance and making the rational decision on which kind of drugs should be used in such kind of a patient. So that is some of the critical things that we need to look at when we're dealing with hypertension, because the different drugs work on different people differently. And once you've been given a particular set of drugs, changing them or even stopping their use is only based on the guidance from a medical practitioner who knows what works best for you based on the different tests that they've done on you, and the ones that they feel are going to give you the best outcomes in terms of your management. So that's a very critical thing. So then we were to move into the issue that we are having now with coronavirus disease. As different reports have been coming up, there's an increased risk of severe complications and mortality in patients, especially those with hypertension. So when we're looking at the patients with hypertension, the different reports that have come, there's 30%, the two of them that I reviewed majorly, the risk of hypertension was 30%. In people who have hypertension developing severe complications, that was 30%, 19% for diabetics, and 8% for coronary heart disease. While another study now had a risk profile of 77% for hypertensive patients, 19% for diabetic patients, and 6% for cardiovascular disease. So when you look at these kind of findings that are coming up, it shows that there is a higher risk of developing severe complications, especially in patients that have high blood pressure, diabetes, coronary heart disease, and any other cardiovascular complications that might be a risk condition in this kind of a circumstance. So those are some of the things that we need to look at as well. However, you might realize that last week when we had the session on diabetes, we were seeing that there was a correlation in terms of the diabetic patients developing complications of COVID-19 were either as a result of high sugar levels, compromised immunity. But in this case, in hypertension, there's no causal relationship or anything that might show people who have hypertension have a higher risk. However, what we are realizing is that for the people who have hypertension, the hypertensive patients, it majorly comes in old age. That's, let's say, from 45, 50 onwards. So if you are an elderly person, let's say from 55 to 60 onwards, chances of getting severe complications from coronavirus disease are high. And therefore, even having hypertension will now just be another disease that you have. Other than that, it doesn't have any, like, you have hypertension, which comes with old age, but now you are at risk of developing severe complications with coronavirus disease because of your age, but not necessarily because of hypertension. So that is very critical thing that we need to look at as well. However, some of the hypotheses that have been tried to look at in terms of the complications that we had, when we're looking at the regulation of blood pressure levels, we talked about angiotensin converting enzyme and the angiotensin as a hormone, as a chemical mediator in the body. So when we look at it, the receptor that has been implicated to be a binding site for the coronavirus disease has been angiotensin converting enzyme receptor 2. However, when we look at in terms of management, we normally use angiotensin converting enzyme inhibitors and angiotensin receptor blockers, especially AT2 receptor blockers. So is it going to be an issue in terms of the management? If these drugs are going to affect the receptor, then there might be a complication that we get with in hypertensive patients. So that's a critical thing. So when we're looking from the evidence, they're seeing that angiotensin converting enzyme inhibitors and angiotensin receptor blockers, the two of them, increase angiotensin converting enzyme receptor 2. So if it increases the receptor, what would be the risk? If it increases the receptors, the risk could be that there might be increased binding sites for the virus, that the virus particle that attacks the body through angiotensin converting enzyme receptor 2. So that is a risk factor. However, they've realized that presence of angiotensin converting enzyme receptor 2, which is a binding site for coronavirus, is also responsible for increased formation of anti-inflammatory mediators, that angiotensin 1 to 7, from the active angiotensin that contributes to high blood pressure, angiotensin 2. So angiotensin converting enzyme inhibitor and angiotensin receptor blockers are responsible for those ones that bind to reduce the levels of angiotensin 2 in the body, which contributes to hypertension. So they help in alleviating the hypertension from lowering the levels of angiotensin 2. However, now with angiotensin converting enzyme receptor 2, which they increase the production of, this leads to reduced levels of inflammation. And we are seeing that the main issue that we're having with coronavirus management is inflammation of the lung tissue, which is as a result of infiltration of the virus particles. So if we are preventing inflammation through presence of angiotensin converting enzyme receptor 2, then it's a positive thing for this. So that is to advantage of using angiotensin converting enzyme inhibitors and angiotensin receptor blockers. Some of the drugs that we can look at in terms of the inhibitors are captopril, lisinopril, and all that. Receptor blockers, we talk of losartan, cadisartan, irbesartan, and all the sartans that we have in terms of drug management. However, so because of that reduction in inflammation, the complication that we've had as well when we're dealing with coronavirus disease, there is been an increase in acute respiratory distress syndrome, that is pneumonia that we're seeing with those patients, myocarditis, inflammation of heart muscles, and acute kidney injury in COVID-19. So those complications are coming as a result of these complications are coming with coronavirus. However, reducing inflammation through use of angiotensin converting enzyme inhibitors and angiotensin receptor blockers will now be a kind of a mediation that is going to lessen these complications. Then also we have the increase in ACE2 in circulation could also bind severe acute respiratory syndrome, the particles of a coronavirus, reducing the ability to injure tissues. Because from the complications, presence of the receptor on the lung tissue, on the heart, and even in the kidney tissue presents a binding site for the virus. When the virus binds, inflammation comes into place and the pathological processes are continuing. However, in this case, when we increase the levels of that receptor in circulation in the blood system that's flowing, then the virus particle binds in the receptor in circulation. It doesn't get to the tissue. So that is another hypothesis that is being looked into. So those are different things that we can assess, but it's not definite. So based on available evidence, the use of these drugs should neither be stopped nor started based on the basis of COVID-19. As medical practitioners, when you're giving people patients drugs to use for managing their hypertension or even in management of COVID-19, we should not indicate them because we are looking at the positive that they give these patients. Because in terms of COVID-19, there's limited evidence, and that lack of evidence should not form as presence of evidence. So we need to be very critical on that matter. So based on that, the next steps that we can take in terms of taking care of hypertensive patients who might be there are risk of getting severe complications. One, we take precautions as much as possible to prevent them from getting infections. And that's where now we have, for example, people from my DAWA, Tony Wood on board, the kind of initiative that they're putting in place to prevent people from getting out of their homes, getting out to go look for the medicine by giving deliveries and such kind of stuff. So those are measures that we can put in place. Adoption of the proper hygiene measures that have been recommended. We look at ways we can prevent infections. Then, in case you get infected, you have a response plan. How do you get to an isolation center that is going to ensure you get access to the care that you need? Very critical. Then the non-pharmacological mechanisms of management, physical activity, lifestyle modification, dietary adjustment, reducing salt intake, avoiding alcohol, reducing alcohol intake, stopping smoking, those are critical. Then monitoring of blood pressure. For you to ensure that your blood pressure is appropriately and adequately managed, you need to ensure that you keep checking every other time to know that it's below the standard, at the standard level or below the 120 over 80 millimeters of mercury. Then you need to comply with your medicines. And when you comply with your medicines, it means as prescribed, you need to continue taking them on a daily basis as specified by the doctor who is managing you as a hypertensive patient. And as a doctor, we have to ensure that our patients are compliant. How do we ensure they're compliant when they're not able to get them? So those are where we now look at the approaches that are going to be adopted. Then as a member of the society, as an individual, we need to champion for continued access to quality care for hypertensive patients. In quality care, we need to look at counseling services, quality medicines that should be accessible to them, and we have to ensure that they are complying with these medicines at all times, and that would be a bonus for us. So that marks the end of my presentation, and I'll hand over now to Tony to come on and share what he has for us. Thank you so much. So welcome on board, Tony.
Okay, thank you very much, David. Let me just share my screen. If you could allow me to share my screen.
Okay, let me just get to that.
If you just let me share.
Done.
Yeah, super. Okay, let me just very quickly run through this for those who don't know who we are. Again, my name's Tony Wood, and I look after my dawa here in Kenya. And my dawa, for those who don't know, is the first e-pharmacy, fully licensed by the Pharmacy and Poisons Board here in Kenya. In fact, we're the only licensed e-pharmacy in Kenya. But really, we're not just an e-pharmacy, we're an e-commerce solution focusing completely on health, wellness, personal care products. We really focus on keeping our pricing as competitive as possible, 20% below retail where we can, and we guarantee the quality of every single product that we deliver. And we do that by securing our supply chain. So more than just a pharmacy, we're also a supply chain solution. But from a patient perspective, we're very much an e-pharmacy. But we're looking at increasing access to affordable and guaranteed quality medication, personal care products, and we deliver them directly to you. And we use that through the use of technology. And really what we stand for is we're patient and consumer focused. Yeah, that's what our whole business is around. Our objective is to support the communities we serve in and really bring value to customers who are either for their prescription products or their personal care products, and make life easy. There's an awful lot of things in life at the moment that are causing people concern. So access to essential medication and the other products that you need to maintain a healthy and balanced lifestyle shouldn't really be one of them. And we do that by operating around 4 particular pillars. Quality is our primary pillar. Quality, we offer quality in the products that we offer. There's in Kenya, there's and this is figures that came from the president of the Pharmaceutical Society of Kenya, but 30% of the drugs in Kenya are either substandard or falsified, so counterfeit products, and that's the estimate, and that kind of fits in with WHO assessments as well. But basically, there's a high percentage of substandard or counterfeit products within the market, so we ensure that we remove them from our supply chain, not just for medicines, but for any of the products and brands that we stock. The other main pillar for us is affordability, and specifically, we looked, as I said, to be 20% cheaper than the normal retail pharmacy. Convenience is absolutely something that's there. I mean, we've been delivering directly to patients, either at homes or their place of work, for the last 18 months. So we've not really had to amend our model significantly to ensure that we can support people who are staying home as part of their part in addressing this whole coronavirus problem. And privacy. The big thing is privacy. Products are delivered in a sealed package. Data privacy is maintained throughout. So those are certain things that are very important to us. Now, as David mentioned, we do direct delivery to patients or consumers if it's non-pharmaceutical or non-prescription products, and many, especially during this particular time, are practicing self-isolation, social distance, or they're just staying at home. And that's especially so for people like hypertensives, those who may have a chronic condition. As David mentioned earlier in his session, they should somebody with hypertension get coronavirus, then the symptoms could be slightly higher. There's a higher percentage that will have severe symptoms as opposed to some of the other people who are out there. So they're deemed as a higher risk. So for us, it's very important that you're able to access your medication. So for us, it's very simple. You can upload a prescription onto MyDawa, and we will process that prescription, and we will then deliver the products. The products are delivered by a licensed farm tech. So we're making sure that there's a professional at every step of the way. If you don't have a prescription because maybe your previous prescription has run out, you're not able to get to your normal doctor, then we can link you with a telemedicine provider, and those providers will be able to carry out a consultation. You'll be able to talk to them about the medication that you're already on, etc. And they can update a prescription if you are not able to get to your normal prescriber. So it's important. Again, as David mentioned, it's very important that you you remain compliant with the drugs, the medication that you've been given. And what we look to do is enable you to do that without any real concern, because you don't have to go out. People don't have to go into a crowded pharmacy at this particular time, and we'll make sure that we deliver them to you. Now, some of the other general things that we're trying to do is we're ramping up the work with telemedicine providers, with health insurers. So if you are covered by a private health insurance, then your medication will remain covered whilst you're purchasing from MyDawa. And we're just trying to make it a bit easier for people to access. So we're working with a number of the telcos now to provide zero-rated data, which means that you don't even need to use your data to be able to access mydawa.com or to use the MyDawa app. It won't take any data from your data bundles. We also know that this period, some people aren't necessarily working. They may have been laid off. They may not be going into work. They may not be getting the income that they were normally used to. So we're also working with a microfinance partner to ensure that patients can take a micro loan just to cover the cost of their medication, to ensure that they can stay compliant with their drugs regime and continue to remain healthy as we go through this. We've eliminated payment costs, so your normal M-Pesa charges have been eliminated. Data costs, as I mentioned, eliminated. So we're just trying to make it much easier to interact and contact with us. Where it now comes to the delivery, we're practicing very much a contactless delivery. So So our rider will come and will deliver the products, and then you can pick them there. You don't necessarily need to interact directly with the riders, but we'll make sure that those things are delivered to you in a timely manner. And what we have is a 4-hour service level agreement. So from us processing your order, we'll deliver that within 4 hours. And as well as your prescription medication, there's a number of other products that you may need to be going out to get, but we can have those delivered to you as well. Everything is online. It's through mydawa.com on your computer or mobile web. It's available on Google Play. It will very soon be available on Apple, and we're currently going through a big upgrade of the whole platform to make it much easier for people to interact with. But if you're not that tech savvy, or if people that you're looking after aren't that tech savvy, then we're also able to we've got a call center that's open, and we can share the details on that. And our call center is open till 9 p.m. at night, where anybody can come along and we can talk you through the whole process. If you are a carer and you are looking after somebody that has hypertension, we also have a facility that we've got on the platform, which is called Buy on Behalf. So if you are perhaps buying medication for your parents who may be up country and may need to have the products delivered to them there, then we can also do that. So you're able to purchase the product, you're able to upload their prescription, just put in their details so we know that the prescription is for them. And then their delivery address, and then we can deliver those products to them. If that's in the Nairobi metropolitan area, we'll deliver those within 4 hours. If it's anywhere else in the country, we will deliver those overnight. So you'll have them the following day, and we deliver those directly to your door by a courier. There is a small charge for that, but that's the only additional charge that we have other than the medication. So I think that's really all I wanted to say, is really just how we are dealing with the current scenario, how we are ensuring that you can have access, or the people you're caring for can have access to the medication that's required without having to go out. You can either buy those yourself and have them delivered, or somebody can buy them on your behalf and have them delivered directly to you. So I think David, that's probably everything that I had.
Thank you so much. So as we move to the next session, we're going to take in questions, of which, Tony, you have one of the questions that have already been addressed to you.
Okay.
Yeah. In terms of the deliveries, are they being done past curfew hours, or there are limitations based on the current curfew that we have?
So we are currently delivering up until 9 o'clock at night. So we've been working with the Kenya Healthcare Federation. We've now got special passes for our riders. So our riders will go out and will deliver past the curfew. So we'll continue to take orders. But we take orders 24 hours a day, so it's an online platform. But for deliveries, we'll deliver up till 9 o'clock. We are looking at getting deliveries back to 10 o'clock in the evening. But then there's some security and safety issues for our own riders, so we have to make sure that we keep them safe as well as keeping our customers and patients safe.
Perfect. Any other person who might have a question, you can raise your hand and ask the question, or you can type it on our chat box.
And just so everybody's confident, I mean, our riders all practice. We were very early to introduce all our safety measures for our riders. So the riders all wear masks. They have gloves when they're handling patients' products. That's both the rider and in our dispensing facility. Everybody there is physically distant. I don't like to use the term socially distant, because we actually need to keep together on a social perspective. But physically, in our facility, we maintain that physical distancing when we're processing products. Our riders all sanitize. We take their temperatures every time they come back into the office, so their temperatures are logged. Our bikes are all sanitized when they come back. We rinse those down when they come back in as well. Our riders all wear gear that can be very easily washed to make sure that there's nothing there as well. So we're taking all the precautions we can. Normally we request our riders to take their helmets off when they go to deliver a prescription or a delivery, because it gives you that bit more of a personal touch. At the moment we don't. They leave them on, not to appear distant, but to ensure that there's protection for the patient and also for the riders.
Perfect. Thank you so much for that, Tony. There's a question from Kamal. Kamal, you can unmute your mic and speak up.
Good evening.
Good evening to you. How are you?
Good evening.
My name is James Kamal,
Okay.
from Kenya Treatment Access Movement.
Okay.
And one of the biggest, I'm a health activist, especially in pharmaceutical issues. Question.
Yes.
Delivery. What is the cost? How much do you charge for delivering? That's number one. Number two, how do you compare your prices with prices of other areas? We do have several pharmaceutical companies, for example, who sell in big numbers, and the prices are low. Thirdly, we know that generics are cheaper, but are you more inclined to the other? These are questions that we need to raise and see. And fourthly, the people, a lot of people, when they get the medicine, yes, I've heard you say there's somebody to be able to explain when they reach, how to take them and everything else. But a lot of people ask a lot of questions which are readily answered, even after seeing the doctor. They are answered by the pharmacists, especially the doctors. How will this continue? Thank you.
Okay, super. There's a number of questions there, and all very, very good ones. So let me just take them as you placed them. So charges for delivery. We don't charge for delivery. We don't charge for delivery within the Nairobi metropolitan area. We do, however, charge if we have a delivery overnight to anywhere else in Kenya. And that's just a simple courier charge, and it depends upon where you are. But I think the average is about 250 to 300 shillings for those deliveries. In terms of our pricing, yeah, I've kind of stated we're about 20% below the average price, and that's the price that you would normally find in a normal retail pharmacy. Yep, I know that there's some wholesalers in the CBD that push volumes that can give you lower prices, but then you've got the cost of getting to the CBD, you've got potentially the cost of parking or your public transport, etc., etc. So I think our pricing is pretty competitive. We constantly review it to make sure that we maintain our competitive nature, and that's really what our business is about. Again, your point on generics, yes, generics are cheaper. What we have in our formulary is we have a formulary that we don't stock every single product of a molecule. I mean, there's many molecules that have a number of generic versions of them. What we do is we'll carry the original product, the branded product, we'll carry 2 or 3 generics where we have been able to satisfy ourselves on the source, where we've been able to check that source, where we've got the documentation for those products to make sure that they are genuine products. So what we do have is we have the original product, we have a couple of very good quality generics. If the doctor has prescribed, or if the prescriber has given you named a product, then we will provide the branded product if that's what they have prescribed. If they've prescribed a molecule, we will provide you with a generic. But we also have a contact center, which is, as I mentioned, is open from 8 o'clock in the morning till 9 o'clock at night. That is always stocked by one of our pharmacy teams. So it's always got a pharmacist or a pharmaceutical technologist on duty, where if pricing is a challenge, we can look at what generic would be the right one for the prescription that you've been given. And if that means going back and having a conversation with the prescriber, we will also do that to make sure that you're getting the right medication and that your prescriber is okay with whatever medication that you are taking. The delivery of prescription medication is by a pharmaceutical technologist. If you have questions, you can ask them. If once they have gone, you have another question, you can contact our contact center, or you can contact us on social media, WhatsApp, etc. So we're readily available to answer any questions that anybody may have.
Perfect. Thank you so much for that, Tony. And actually, one of the things that you've just highlighted that we need to understand as well, James Kamal, when we look at it in terms of accessing care, the prescriber can have a decision as to whether they're looking for a brand or not the generics. So at the end of the day, the final call starts with the prescriber determining which kind of product would work well for you. And then once it's been processed, then the cost is an issue, as Tony has suggested. There's that need to discuss with the pharmacist, the pharmaceutical technologist, and the doctor who prescribed to know whether it's feasible for being changed for another alternative that might be cheaper to the patient. Because when you're looking at access, we have to ensure that the products are available and the patient can get them affordably, rather than being at a cost that they can't afford. So that is a very critical thing as well. But hopefully, we'll be in a position, I know my DAWA will be in a position to guide when there's need for such, and that will help ensure patients get their medicines when they need them. Yeah. Any other person who might have a question? If there's none, to close up, I'm going to suggest that one, as agriculture, health, and social innovation, just to give you a recapping statement, our mission is to ensure we are a health advocacy group, a social enterprise. We are looking at educating people about the current health issues that we have, from every other health condition that we need to address. Once you get the information, we are championing for access to healthcare services. And when we champion for access, we don't only talk about what needs to be done, we are looking at getting people who can help ensure that people have access to the care. And for example, that is what we did today by having Tony on board. My DAWA is working to ensure people have access to care. If we can bridge the gap where we are as individuals, we are telling you what to do, what needs to be done at a particular moment, and get you to the person who can ensure you get access to that care, then that's a win for us and it's a win to the entire society. And that's what we are looking at putting into place and ensuring we can get to achieve our goal. And Kamal, for the presentation, I can share, you could just send me an email to info.reculture@gmail.com and I'll share it with you. Thank you so much.
I had one more last question.
Thank you.
I had another question.
Yes.
Are you NHIF pre-qualified, and are you pre-qualified by, or do you use any other medical insurances?
Tony, that's for you.
So at the moment, we don't take NHIF. That will be something that we'll be working with the NHIF going forward to ensure that we can do that. But we do work with, I think we have 10 private health insurers already on our platform, and we're continually adding those. So yes, we do work directly with health insurers, which means that you don't have to have any out-of-pocket expenditure, because we deal directly. We're linked directly to the insurance companies.
Perfect. So thank you so much, Tony. I'd give you a final moment to say you have send your final regards. Then we end the session.
Okay, no, well, thank you very much. It's been a pleasure being able to talk to you. I hope that I've given you some understanding of what we do and some of the services that we can provide and how we've kind of modified things and how we're able to help as we manage through this this current COVID-19 pandemic, and then when we move into whatever the new normal is, I think it will be some time before people get back to the old way of doing everything. So we will be continuing to innovate. We'll be continuing to add new functionality to our platform, just to ensure that we're able to meet with you and with our customers' expectations, to make sure that we can help you stay safe during this time, and also make sure that we can keep our staff safe, so that they can help you stay safe.
Perfect.
So I think that's it from me.
Thank you so much. And it's been a pleasure having you on board. I hope we've learned, and we're going to apply some of the lessons that we've gotten from here. Thank you so much.
Okay. Super. Thank you.